My name is Kevin Hogan. I'm an ER physician here at Nashville General Hospital. I've worked here for 3 years.
My name is Amira Tahir. I'm a nurse practitioner here in the emergency department. I've worked at Nashville General Hospital since 2004.
Well, last year at this time, we were dealing mainly with the flu. And I think that now that we've got multiple things to think about, not only do we have our regular patients who come in, who we still are having them come in, but we also have to deal with COVID-19. So that's the main change that we've had.
I agree. Last time this year we were dealing with sports injuries, gardening injuries, your run-of-the-mill patient, and this year the main focus is COVID-19 patients.
Most significant change, I think, is a lot of things that we practiced previously, the preparing for patients before we see them with PPE, face mask, gowning, gloving, another term for donning and doffing. We've really put those things to more regular use that we have in the past. Typically we used to do this with the tuberculosis patients, but now we're doing this more regularly, so we're getting actually pretty used to it.
What's different now is every patient that comes in with upper respiratory symptoms has to be treated as a COVID-19 patient. You have to take those precautions to protect yourself from contracting it. And we're using a ton more PPE than we were before. As Dr. Hogan said, before we were only using that type of PPE with tuberculosis patients or suspected infectious disease patients, but most all of the patients that are coming in with upper respiratory infections, we're having to use PPE on to protect ourselves.
The biggest challenges throughout the day, I'd say, are maintaining a level head, not overreacting when you see a patient come in who's sitting in the 50s or 60s and is actually talking to you. These COVID patients are presenting differently than we've ever seen before. So it's just pretty much keeping your cool and doing what's best for the patients, because it's always at Nashville General, we're very patient-centered, and we just focus on what's best for the patient. Normal saturation is in 94, above 94% typically. Some COPD patients can go down to 92%, but we're seeing saturations that we've never seen in talking, normal mentating patients.
Yeah, that is one of the biggest things I take away from it is looking at these COVID-19 patients. And normally when you see a patient with an oxygen saturation of 56%, that's usually incompatible with life, and that person needs to be intubated. And these patients are speaking and walking with low oxygen saturations, which is very, very surprising to us. We will never turn anybody away or care for them any differently than we would if they were not a suspected patient. But I want them to know they can help us by not needing our services and by staying home. And then if they do leave home to go to the supermarket or wherever they need to go, to please wear a cloth mask to protect themselves and to protect those around them. Because what's tricky about this is that you can be a completely asymptomatic person walking around in the community and spreading it and not know it. Mm-hmm. You don't want to hurt someone unknowingly. You don't want to hurt an older person with diabetes or that's immunocompromised. You really don't want to hurt anyone. So the best thing I would say is to stay home, and if you have to leave, to wear a cloth mask as it's recommended by the CDC.
And I agree with Amira. I think you should stay home. Of course, I have to say, if you have, chest pain or shortness of breath, or you having stroke-like symptoms, numbness or weakness on one side or the other, you still need to come to the ER. We still need to see you. But if you think that you have symptoms of COVID, maybe you have a fever or you have a cough, I would stay home. But if you start getting shortness of breath and you and your family feels like you're struggling to breathe, of course you need to come to the hospital and see us. But I would definitely recommend that you maintain distance. Don't go to any parties. Don't, even if you're walking around the neighborhood, please stay at least 6 feet distance from people, because I've been seeing people, they've had days off, and they're working from home and they're still getting close to people, and I think that's going to actually make our job more difficult.
Yes.